we need to ensure that families are supported when they show signs of maybe having a language disorder or an autism a spectrum disorder diagnosis. We need to support families who want and need to raise their child in two languages. Hi, I'm Myriam Beauchamp. I'm an assistant professor in the School of Rehab Sciences, the speech pathology program at U Ottawa. One of the things that I try to support and advocate is access to healthcare services for minority language speakers on the autism spectrum. We know that bilingualism leads to, first of all, it doesn't hurt language development at all in kiddos with neurodevelopmental conditions. And in addition, it seems that there may be, in kids on the autism spectrum, there may be advantages, cognitive advantages to being a bilingual speaker. So when we take that minority language away, we're not only taking opportunities to communicate from these children, but we're also taking away opportunities to develop these cognitive skills, or what we call access to the bilingual advantage. And so I am very passionate about kids having access to that equity, because I have seen firsthand how difficult it is for families when the children don't. You know, clinically, I had seen the need for this type of research because families were getting recommendations against speaking their minority language to their child. And I remember clearly, and this is, one of those experiences, clinical experiences that stay with you. There was a family, new immigrants to this country, and the child had gone through an assessment and clearly had language delays, at least, potentially a language disorder. And when I spoke to the parents, the mother asked me if she could speak her minority language with her child. And when I said, yes, of course you can, her eyes welled up. And she said, oh, thank you. And that sigh of relief that I wasn't taking away, because her English was fairly limited, but I wasn't taking away this ease of communication that she had with her child. That I'll never forget that relief. It matters. Families have guided what I do. Their questions, their experiences. I've learned so much from the families with whom I've worked. I'm very grateful to them for having shared their experiences with me, because it absolutely guides the research that I do and the values that I have today as a researcher. Absolutely.